The film you are about to see is a documentary following Angelica Piccini as she is diagnosed with and later treated for pancreatic cancer.
Hello, Dr. Patel.
Hi, Miss Piccini. What brings you here today?
Strangely, I don't know, I've been experiencing chronic abdominal pains, unexplained weight loss, and for some reason my skin is starting to turn into a yellower tint.
So, according to my chart here, Miss Piccini, it says that your symptoms may be the result of pancreatic cancer, but we won't know until we run the test.
What's pancreatic cancer? Does that do anything to my cells?
So, pancreatic cancer is a form of cancer where genetic mutations occur in your body and faulty cells are produced. These cells can eventually form into a tumor by growing rapidly. The tumor will take nutrients from your body and cause your body parts to not function. This generally affects the ducts of the pancreas that releases the enzymes that digest food. So pretty much your digestive system will not be able to function properly.
Oh my goodness, are there any tests I should take to see if I'm diagnosed with this cancer? And do you think there are any symptoms I should look out for?
Well, the symptoms you should look out for are abdominal pain, weight loss, jaundice, depression, and blood clots. The tests that we can do to diagnose you are ultrasounds, CT scans, MRIs, endoscopic ultrasounds, and those just form a picture within the abdominal cavity, or even ERCP, which dyes the cells in the ducts so they can be seen under a microscope. An exploratory laparoscopy or blood test could also be done to inspect for the presence of cancerous tissue in your body.
Well, when can these tests be done? I'd like to be aware immediately if I have this cancer.
Well, if you want, the test can be done today in this office.
Alright, so when will the test results be in?
Well, from the ultrasound, we'll notify you as soon as the results arrive.
Okay, thank you, Dr. Patel. Thank you.
Thank you. The results of your test came back from ultrasound, and I have some very bad news.
Well, what is it?
I'm sorry to inform you that there is a cancerous tumor in the head of your pancreas. It is unfortunate that your symptoms have delayed, and they took a while to be visible.
Well, what could have caused this?
There's no real concrete answer, but all we know is that there's a mutation in your DNA, and that caused the tumor to grow from faulty cells.
Okay, but could other factors have affected this?
Well, there could have been a genetic mutation passed down from your mother or father, but that hasn't shown until now. And there could have been other outside factors like ultraviolet light that was exposed to you that mutated in your cells. Do you tan a lot?
Well, I mean, I used to when I was younger. Okay, so if this is genetic, is there anything I can advise my family to do to prevent this from occurring to them?
Well, there's several things you can do to prevent cancer. First off, don't tan, right? Then they can also maintain a healthy weight, eat a nutritious diet, and obviously don't smoke. This will help decrease the likelihood of family members that form the cancerous tissue.
Out of curiosity, who's at the highest risk for developing this cancer?
Well, those who are obese, smokers, African American, they have pancreatitis, diabetes, or those who have a family history of pancreatic or other cancerous conditions are at a higher risk of developing pancreatic cancer.
Well, now that I have the disease, what can I do to treat it?
Well, I can recommend you to Dr. Soham Patel to answer all your other questions.
Welcome, Ms. Piccini.
Hello, Dr. Patel.
So what brings you here?
Actually, in fact, Dr. Patel recommended that I come here to discuss cancer treatments.
Well, the first thing we have to do is decide which stage is in.
Well, how do you figure that out?
Well, we can either do a laparoscopy or multiple blood tests to figure it out. If it's in early stage, we can just do the Whipple procedure and remove tumor. But if it's in the later stage, we either have to do radiation therapy or chemotherapy. With radiation therapy, we can target the specific cells, but we may end up killing some of the surrounding cells. But with chemotherapy, if your body rejects the drugs, it won't affect you. So, if the cancer's reached stage 4, there's nothing much we can really do for you but give you drugs to ease the pain while the end comes near. But it might just be better for you if you make some lifestyle changes, like eating healthy, staying active, keeping yourself fit. the best you can do.
Thank you, Dr. Patel. When can I take these blood tests?
We'll get on it right now. We can get the results back soon.
Okay.